the vast majority of my patients have heart disease to some extent. Most of them have some fairly significant heart disease. So I deal with that on a regular basis. So I'm not a cardiologist, I'm not a heart surgeon, but I have extensive experience with heart disease and, some of the diseases we treat overlap.
This is the Healthy Lifestyle Solutions podcast, and I'm your host, Maya Acosta. If you're willing to go with me, together we can discover how simple lifestyle choices can help improve our quality of life. Let's get started. Welcome back, Dr. Riz.
Thank you very much. It's good to be back again.
It's a pleasure to have you back. I understand how busy you are. I know how busy you are because we live together, of course. So I appreciate that you're taking the time to answer some of those concerns that people have. As you know, in February, I focused a lot on heart disease. I invited a couple of cardiologists to come on and speak about that, more specifically to my female listeners, because I have a lot of women that now listen, and I'm starting to tailor the podcast to really support women in health, especially because I'm part of the Women's Health Interest Group for the American College of Lifestyle Medicine. So I was hoping that in this segment, we can answer some of the concerns that people have about heart disease. And I recently received an email from a lady named Lisa out of San Antonio, Texas, who is concerned about heart disease. She said that heart disease runs in her family, and now she's fearful that she will develop heart disease. In our previous segment, you talked about how you learned about lifestyle medicine and why it's even more important for you now to recommend these modifications, lifestyle modifications for your patients. If Lisa is concerned about heart disease because of her family members, should she be afraid that she might also develop heart disease?
First off, I'm a vascular surgeon. So that means I deal with the diseases of the blood vessels. And one of those diseases that I specifically deal with a lot, it's the majority of my practice, is atherosclerosis. And that's where I overlap with my cardiology colleagues, and they also treat atherosclerosis. Also, the vast majority of my patients have heart disease to some extent. Most of them have some fairly significant heart disease. So I deal with that on a regular basis. So I'm not a cardiologist, I'm not a heart surgeon, but I have extensive experience with heart disease and, some of the diseases we treat overlap. So I'd be happy to comment on these things and talk about what I do know. So first off, heart disease is a very generic term. Okay, it just means diseases of the heart, and there are many diseases of the heart. And you can think about heart failure diseases. That's where the pump isn't working very well. Or you can think about rhythm issues where the rhythm of the heart is not exactly right. Or you can talk about atherosclerotic disease of the heart, and that's where I overlap with my cardiology colleagues because I treat atherosclerotic disease of the blood vessels outside of the heart. And so, in Lisa, to address Lisa's question, if her family members a lot of her family members have had heart disease, should she be worried? And I think the answer, the big answer is yes. Okay. And, but you have to take a look at it in the context of what heart diseases did her family members get, and why did they get those heart diseases? And the easiest way I can answer that question is if a patient of mine comes in and said, my dad had a heart attack and a stroke, and I'm doomed to have a heart attack and a stroke. I typically will answer to them, yes, you are doomed to have a heart attack and a stroke if you do exactly what your dad did in his lifetime. Mm-hmm. Okay, which is that he ate a lot of saturated fat and processed foods and a meat-centered diet, and he smoked, and he was obese, and he had hypertension and diabetes, and he didn't get any exercise. Mm-hmm. If you do those same things, then you're most likely going to have the same problems he did. But the control is in your hands, and if you change the way you do things, then you have the opportunity to change the outcome. And so that's how I express that to my patients. Another way of looking at it is the definition of insanity is doing the same thing every time and expecting a different outcome. So if you want to change the outcome, you have to do something different.
Mhm.
And you might look at it in the sense that uh, people with that attitude, that my all my relatives had it, so I'm going to get it too. They think that there's a that genetics control everything about how our outcomes are. And I address that again by saying that yes, genetics has an impact on us. It has an impact on all of us,
Mhm.
but the expression of those genes is tremendously impacted by our lifestyle choices. And so, if you change what you do, you can change the outcome.
Yeah, that's a great answer. Tell us your story of how you learned about lifestyle medicine and the benefits of plant-based nutrition.
So, I'm a traditionally trained what I call Western medicine vascular surgeon, where we're taught to treat cardiovascular disease from a surgical standpoint. You wait for someone to get the disease, and then when they have it, you do whatever you can to fix the problem and improve their quality of life, or save their limb or save their life.
What is the first recommendation? Change your lifestyle, eat more greens, or go get some of these tests done just to see if you have blockages?
I think that that depends on the age of the person, their overall health, what their family history is. So all of those things are taken into account when evaluating someone, and then deciding where do you start with what tests.
Mhm.
And all healthcare is individualized, and so that's why when someone comes in, we take a careful history and physical, and we go over all their medications, and we go over their lifestyle, and we go over their family history, and so everything's very individualized. It's not just a cookie cutter, one answer fits all type of situation. One of the very easiest things to do is immediately start with lifestyle changes.
Mm,
Okay,
mhm,
that doesn't require all of that in-depth reviews, as that's not going to affect what labs are ordered or what tests and studies are ordered.
mhm.
And so for me, lifestyle changes is an easy thing. Anybody at any age should be concerned about what their lifestyle choices are and what changes they can make to live a healthier lifestyle,
Yeah,
whether you're 18 or 37 or 62.
yeah,
Okay. And so, that person can immediately take a deep dive or a closer look into what is their lifestyle like,
yeah.
and where can they make an impact on those choices. Something though that I think is important is that when you've identified these things, you have to take a good look at yourself, and an honest look at yourself.
Mhm.
You know, sometimes that's very hard for people to do, but if you want to take an honest look at yourself and then identify those issues, don't try to change everything all at once.
Yeah,
That's really kind of setting yourself up for failure.
yeah.
If you fail to plan, you plan to fail.
Mm,
And I think that you kind of have to come up with a plan, and it has to be a stepwise plan. It has to be an achievable plan. Okay. And so, uh, for example, if you look at yourself and you say, well, I eat fast food 5 days a week, and I'm 20 pounds overweight, and I don't exercise. And so now you've identified three things that you can address, which is your diet, your weight, and your activity level. I would say, though, to specifically address Lisa's concern about heart disease, she can go see a cardiologist who can then help her assess what
mhm.
her cardiology risk is
Yeah.
based on current standard methods of lab testing and other diagnostic testing. And so she can understand what her risk is. And involved in all of these changes, in my opinion, are looking at your biomarkers. Do you have high blood pressure? Do you have diabetes? Do you have high cholesterol? And if so, those things need to be addressed as well.
Mm.
And those can be addressed quite remarkably through lifestyle changes, as well as the use of traditional medications.
Yeah. Actually, I'm so glad that you brought that up because those, as we know, are risk factors for heart disease.
Hmm.
And I wanted to recommend just a couple of things. One of them I know that you read and is what got you on board yourself when you first made these changes. So, Prevent and Reverse Heart Disease by Dr. Caldwell Esselstyn.
Yeah, so that was one of the when I started to understand that lifestyle changes were so important. One of the first books that was quite convincing for me was How to Prevent and Reverse Heart Disease by Caldwell Esselstyn. And as a brief summary for that book, he had patients, I think it was about 24 or 25 patients, who had been deemed non-operative candidates for bypass operation. And basically, their disease was so bad that even a bypass operation wasn't going to fix it. That essentially is a at that time back when he was doing this was a few decades ago. That essentially was a death sentence. In many respects, you might have labeled those patients hospice patients. Okay, you might say to them, with knowing what you have and the fact that we can't help you, you have less than 6 months to live. So Dr. Esselstyn took that cohort of patients and put them on intensive lifestyle therapeutic changes, which is the basis of the how in lifestyle medicine we can treat disease. So we've talked a lot about preventing disease, but you can also treat disease through lifestyle changes, and we call it intensive lifestyle changes because you have to change what you're doing very aggressively if you want to reverse or stop something. So he put them through intensive lifestyle therapeutic changes, and very specifically their diet.
Mm.
And he took them off of the very standard American diet, SAD or SAD as we call it. And what a wonderful reflection upon what that diet really is. So he took them off the SAD diet and put them on a whole food plant based diet. And it had such a tremendous impact that my understanding is that 85, 90% of them were still alive at 12 years later.
Oh my
what
gosh.
what anybody wouldn't do who was told they only had 6 months to live, and suddenly you get another decade out of it or 15 years out of it. That's actually quite remarkable. The thing I would say about coronary artery disease, and it's just not studied enough to show how extensively we can reverse the
Mm.
disease.
Hmm.
One thing I do know is that we don't have to reverse it very much to take them from a symptomatic situation to a non-symptomatic
Right.
situation. Just a few percentage points in the change of a diameter blockage can
Mm.
make all the difference in the world. And it's multifactorial when people are having symptomatic issues with their heart.
Hmm.
It's not just the narrowing of the artery and how much blockage there is there, but it also has to do with the resistance to blood flow, has to do with the nitric oxide in our body. It has to do with the compliance of our blood vessels. The
Hmm.
compliance of our blood vessels is changed by the amount of oil we ingest.
Mm.
And in a whole food, plant based, oil free diet, you've changed the compliance of your vessels. In taking in more green leafy vegetables, you've increased the nitric oxide in your body. So you're making changes at a molecular and microscopic level that have multiple impacts. And if all of those different things make just a small few percentage point changes, when you cumulatively they can make a more significant change.
Mm.
And again, it might not take a whole lot to take somebody from being end stage and symptomatic to getting them back to a place where they can live.
Yeah. Oh my gosh. Just the fact that you said that we don't have to completely reverse atherosclerosis. We don't have to clear our arteries completely to enhance our quality of life, but we can jumpstart ourselves towards a better life by making changes right now.
We used to think that atherosclerosis was a disease of old age. But what a better way to state it is it's a disease that presents itself in older age. But the reality is it's developing throughout the course of our lives based on our lifestyle choices and specifically our diet.
Okay.
And there was a study of Korean War vets killed in action back in the 1950s, and it showed that 78% of these 22-year-old young men had the beginnings of atherosclerosis in their arteries. And so that's just at the age of 22. And these were people eating what we would have the standard diet back in the 50s,
Mhm.
which wasn't anything compared to how bad our diet is today.
Okay.
And so, interestingly enough, in more recent times, they're seeing that uh, there's these fatty streaks or the beginnings of plaque in young children, in prepubescent children. And then more recently, we're seeing fatty streaks that already exist in utero in unborn babies based on the diet that their mothers
Oh
eat.
my gosh.
So it's a disease that starts young and then builds up over time. And again, it's largely related to
Mm.
our diet.
Wow. Thank you, Dr. Riz, for joining us today to discuss heart disease. I'm also going to add a link to a blog on my Healthy Lifestyle Solutions podcast website. And I've been adding resources there. So if you want like a printable list of foods that you can start eating today to care for your heart, or even exercises, I've been recommending apps that people can use. I know that you like to use apps for stress management or for tracking your exercise regimen. All of these tools are meant to help support you in improving your heart health.
I wanted to add that yes, I do use a lot of apps. I use apps for meditation. I use apps for stress management. I use apps to track my sleeping, and I use apps to track my exercise.
Mm-hmm.
So all lifestyle related issues, and you can use apps when you can actually measure what you're doing. It has a greater impact than on you trying to just guess or estimate. And I'm trying to figure out how to use an app to better track my diet. But that takes a little bit more work, and I haven't quite gotten there yet. You know, when we're talking about making small changes or these lifestyle changes and just making small incremental reversals in disease, I don't know for sure that we can 100% reverse our disease. I can only imagine the amount of lifestyle changes and the length of time it would take to do so. But I can give you an example of something in my profession where just a small change would make a big difference. And that's with carotid artery disease. We do treat asymptomatic carotid artery disease in an effort to prevent strokes. When we have patients that we're following and they might have 50% or 60% blockage in their carotid artery, there comes a point where we know, based on the previous studies, that once you reach a certain blockage, it's better to have the operation than not have the operation to fix it.
Mm.
Okay. In some people, we use 60%. In some other people, we use 80% blockage. And so let's say someone presents with a 65% blockage, and that means that he is at significant risk for having a stroke. That means that medical therapy is worse than surgical therapy. It's better to have the operation than. But what if that person were to make intensive lifestyle therapeutic changes
Mm-hmm.
and just reverse that disease 6%?
Mm.
Okay. And then suddenly now the next time they come in at their 3-month or 6-month checkup, and that might be wishful thinking. It might take longer than that.
Mm-hmm.
But if they come in at 60% or 59%, well, they've just taken their risk down, and they're no longer in that same risk profile of somebody with 60% or greater disease,
Mm-hmm.
and they might be able to avoid an operation by
Okay.
doing so.
I see. Well, thank you for that. Dr. Rizwan Bukhari is the owner of the North Texas Vascular Center here in Dallas, in the Mesquite area more precisely, and you also work with a couple of other hospitals. And I want to thank you so much for your time again.
Thank you very much. I wanted to.
You've been listening to the Healthy Lifestyle Solutions podcast with your host, Maya Acosta. If you've enjoyed this podcast, do us a favor and share with one friend who can benefit from this episode. Feel free to leave an honest review as well at ratethispodcast.com/HLS. This helps us to spread our message. And as always, thank you for being a listener.